All right, so the doc has diagnosed, oh, I'm Marie, I'm your nurse. The doc has diagnosed you with asthma, and I'm just going to share some information with you about asthma
Okay.
and how you can help it going, you know, help your symptoms or attacks or what have you going forward.
Okay.
So, do you know what asthma is?
He explained it a little bit, but it's still kind of a little confusing.
So, pretty much, it can, well, in your case, it's a chronic disease pretty much that causes a reduction of airflow in the airways by inflammation and like tissue sensitivities in the lungs, pretty much, in the um, bronchioles. So, and it pretty much they like instead of them being open, they're closed by constriction.
Mhm.
So, and that inflammation was cause your breathing problems. So, some causes of it is like allergens, that the bronchospasms, which pollutants in the air and viruses and stuff like that can cause that. Sometimes aspirin and NSAIDs like ibuprofen, things like that, can cause flare-ups as well. Um, GERDs can cause flare-ups as well, especially at nighttime, because the high acid in the stomach, it can cause the more sensitive, cause the tissue to be more sensitive. So, um, some symptoms of asthma, which I'm sure you know of because you've experienced some of them, but just in case you don't, you'll have on and off episodes of difficulty breathing, some chest tightness, coughing, wheezing, some mucus production. So you want to watch for any increases of that if you have some of those symptoms. Um, be aware of people who's smoking. Are you a smoker?
No, ma'am.
Okay. Well, be aware of anybody who's smoking as well. That can cause a flare up for you as well. Okay.
Okay.
Um, do watch for do watch for in most chronic cases. Some people have barreling of the chest, so pretty much you'll start seeing your chest get broader and more rounder. So do watch for that, and also like any grayness or blueness of your lips or fingertips or stuff like that. Okay.
Okay.
If you do see any signs of those, like you do need to see somebody immediately. So some management. Um, just make sure you, if you can, keep a diary that includes your symptoms and interventions for specific triggers, early cues of an attack, of course, and your response to certain drugs. Um, oh, avoid any environmental drug or food triggers. If you do have like exercise-induced asthma, try to take your medication at least 30 minutes prior to. It should it should help prevent or reduce any attacks or you know. Um, Also, you try washing your linen in hot water versus warm or cold because it will help destroy any dust or mites that can possibly cause your asthma to flare up.
I did not know that.
So the doc will be um, the doc will be like what's the word, prescribing you either a well, it should be prescribing you a bronchodilator along with a oh yeah, he should be providing you a bronchodilator. One should be a short acting, the other one a long acting. With the short acting bronchodilators, they relieve they they relieve the attacks, asthma attacks. Um, and with the long acting, they are pretty much much they allow you to decrease the need for the short acting ones.
Okay.
And then sometimes they may give you a corticosteroid. So basically, it helps reduce the inflammation that you have, depending on how acute or how chronic the asthma is. Another way you can help manage it is by exercising and activities. It promotes, you know, it promotes what is it? Gas exchange, perfusion. It also helps build your cardio health and strengthen your muscles as well. And last but not least, some oxygen therapy if it's necessary. So, any questions?
No, ma'am.
All right. Hopefully that will. I was hoping I'd give you enough question info to kill all